Welcome to our crash course on ear infections. Ear infections are more common in dogs than in cats. Dogs' ear canals have a vertical portion that can trap liquid wax and debris, which creates an ideal environment for bacteria and yeast to grow. Cats have a more horizontal ear canal, which allows for better drainage. Those dogs that have long, floppy ears, they get poor air circulation into that ear canal, which also leads to moisture buildup and increases risk of infection. Also, many dogs suffer from allergies and are prone to recurring ear infections. While cats can get ear infections, they're generally less common. They're usually caused by ear mites. And when cats do get ear infections, they can sometimes be more severe and can be complicated by the growth of polyps. Here you can see the J shape of the ear canal, the vertical portion that also bends down to the horizontal portion. And once something like water from the bath or wax or oil debris gets down in there, it becomes kind of trapped and there's no way for it out. Also, foreign bodies can get in the ear like foxtails, which is a kind of a feathery, flowery portion of grass, which causes a lot of problems for dogs' ears and eyes. And then also allergies can make this worse. Bacteria, fungi, and yeast build up when there's moisture and things trapped in there. And then also mites can get in the ear as well. When a dog has an ear infection, you may see these common clinical signs: head shaking, ear scratching, erythema, which is basically reddening on the skin, pain where the ears are massaged or manipulated so they don't want to be touched there. You may see foul odor from the ears and also discharge coming from the ear canal. So here are some common species of yeast, bacteria, and mites that you might find in an ear. To the left, you see the purple stained picture above is of a yeast species that's very common in dog ears. It's called Malassezia pachydermatis. And this is called pachydermatis because it was first isolated in a rhinoceros species. We treat this with some antifungals like miconazole, clotrimazole, or ketoconazole. A bacteria that is very often in the ears is Staphylococcus aureus, and that's the one that you see on the bottom right there. Another one is Pseudomonas aeruginosa, and these are very common in ear infections. Staph aureus, usually we treat with cephalexin, cefavecin, or amoxicillin clavulinate, which is also known as Clavamox, that combination. Pseudomonas aeruginosa is a little bit more resistant to some of those other antibiotics, so we have to use some other different options. And some other species you may see in ears are Proteus, Enterococcus, Streptococcus, and Corynebacterium species. Some common mites that you see, the most common is Otodectes cynotus, which is there all the way to the left bottom. And then you also may see Demodex species, Notodendres, cat eye, and Sarcoptes scabiei. These live on the surface of the ear canal and can sometimes spread to the face and head. Their entire life cycle occurs on the host and lasts about 3 weeks. Because it's highly contagious between animals through direct contact, it often passes from cats to dogs. And one of the treatments that we use is milbemite, which is a one-time treatment. Here's just a close-up of some of the microscopic evaluations. On the top left, we have A, the Malassezia species, the yeast, which stains purple but is a lot larger than the bacteria that you're looking at on the right, which is the Staphylococcus species, which again is a cocci, so it's small circles, and then it also stains purple because it's a gram-positive bacteria. Bottom left, you have some keratinized epithelial cells taken from a dog's ear after treatment, and on the right, we have the Otodectes cynotes species of mite. There are 3 levels of ear infections with dogs particularly. We have the simple ear infection where there's mild debris, a good cleaning, and some medication at home usually clears it up in a couple weeks. And then what we have is the level 2, which is a reoccurring ear infection. And that's when those regular medications don't work. There is a culture required to pinpoint the organism because our first antibiotic or medicine didn't work. The cleaning of the ears has to become a regular thing. And then allergies usually are the most common cause of this, or hormonal imbalances. Then we have the level 3 end stage ear infections. This is when we have chronic inflammation that leads to proliferation of tissue, scarring of the ear canal, mineralization of the ear canal. And when it cuts down into the middle ear, we have nerve damage, which can lead to things like head tilt, neurological symptoms like lack of balance, nystagmus, and even paralysis of the facial nerve. Then at these points, a lot of the times there is surgical intervention. And there's two types of surgeries that are most common in this situation. One of them is the lateral ear resection, and that's where they actually remove the vertical portion of the ear canal. And then there's also a surgery called an ear canal ablation, where they remove and seal the ear canal. Reoccurring ear infections can lead to oral hematomas. When the dog's constantly shaking and scratching at the ear excessively, it can cause the blood vessels to rupture, which causes the blood to escape into the tissue of the pinna or ear flap. And this can lead to a hematoma. We usually remove these by removing the blood clots and bandaging the ear, and this is done under anesthesia. Lastly, if you have a dog that has one of these reoccurring ear infections, we're going to have to do a cytology and possibly a culture. You'll need an otoscope to inspect the ear for any mites or ticks, and also to see if the eardrum is intact. We're going to use some cotton tip swabs, and we're going to try and get into the horizontal portion of the ear canal because that's where all that stuff lives. And remember not to pull on the ear, because while you're in there, you can actually damage the eardrum. You may need mineral oil if we suspect that there are mites, and you may need a Diffquick stain or possibly even a gram stain and a microscope with a 40x objective. Once you get a sample from the ear, you're going to do a 360 complete revolution of the swab onto a slide and let it air dry. If we suspect yeast, we can use the Diffquick stain, and we can also see bacteria with that. If we want to make another slide, we could do a gram stain if we want to get a better idea of what type of bacteria we have. And then if we suspect mites, you'll use a drop of mineral oil. And then you can use the 40x objective for all three of those things. You don't want to use mineral oil with your oil objective because it may damage the microscope. So you remember not to touch the lens to the oil. Another thing I want to mention is you always want to make a separate swab for the left and the right ear, because we may have different organisms in the left ear than we do in the right ear. And if you're sending them out to the lab, you want to make sure that you label them correctly so that we know what's going on in both ears. Sometimes these dogs can have really swollen ear canals, and when it gets to that point, it's really hard to diagnose and treat and resolve. So just some important points. I hope you enjoyed our lecture on ear infections, and come see us again on VetTechStuff. Bye.